All, this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. This is our fourth show for today. Of course, we had a sobering news today, and I wanted to make sure that we get ahead of it. One thing, so Steve, Steve is number one, absolutely. Diaz, hi. Carolyn, hello. Mia, hello. Sumit, hello. Good day. Carolyn, third. Diaz and Steve wins, yes. Ali G, hi. Rubies, hello. Anna, hello. And now I'm going to have a big list. So hello to everyone. So one thing that I neglected to show is the book itself. So I wanted to, now whoever is here, let's look at the book. So this is, if you read here, current medical diagnosis and treatment. It is 2016, so 3-4 years old. But still, this is the heparin-induced therapy. And what I wanted to show you, I thought I would show it in the main video as well, and I forgot. Number one, the symptoms and lab for HIT, that is heparin-induced therapy, thrombocytopenia. And here, if you see, the test is the platelet factor 4 ELISA. And treatment, if you see here, the treatment is argatroban. And then this is the dosage and titration. But what they see after this is duplex Doppler should be done. The treatment should continue till the 100,000 platelet count per microliter is done. And then look at this, always hematologist has to become involved. It is not a simple thing. So hematologist has to become involved. So look at this, due to the tremendous thrombotic potential of the disorder and the complexity of the use of the DTI, all patients with HIT should be evaluated by hematologists. So replace over here HIT with the vaccine-related issue, and DTI are the thrombin inhibitors, that is argatroban. So there is complexity around that. So one, hematologist should be involved. And number two, when to admit. Most patients with HIT are hospitalized at the time of detection of thrombocytopenia. Any outpatient in whom HIT is suspected should be admitted, because the DTI must be administered by continuous intravenous infusion. So I wanted to make sure that we are all on the same page here. Okay, so how is everyone? Michelle says, good night, Dr. Bean. Good night. Good to be back. Colombian Coffee Bean, did you sign your title? Did you reserve it? So Tiria says, Dr. Bean, good to see you well with spring in your step after your vaccine. Thank you very much. Thank you very much. So I had Moderna. My wife had J&J. She has, I think, a couple of days earlier than me, she had it. So she's a little ahead of me. I think 7th or 8th day today for her. Susan, how are you doing? I hope you're doing well. Denise, I hope you are doing well as well. James, welcome. And so would you like to hear a couple of news? One little less happy news and one happy news. So less happy news, I'm going to read that for you. So give me 1 second. It is in an email. So remember that my videos, 54 of them were demonetized in one day. And some folks said that, hey, this must be just, people's interest is reducing and so on. So there is a friend of ours who is also a friend of folks from FLCCC, Dr. Paul Merrick, Dr. Pierre Corey, Tess, myself, and others. And he has been really helping to try to get to YouTube to say, what are you guys doing? And here is an email that he sent. The email's headline is, and this is Steve, his name is Steve who sent it. His headline is, here is why you are being censored on YouTube for Ivermectin videos right from the CEO. So the message is, the following, and I'm going to censor some parts of it because of the so that he can continue to go to them and ask them for more help. So he said, YouTube isn't interested in who is right or who is wrong. The NIH, FDA, WHO, Merck, IDSA say not to use, and YouTube would enforce not to use. So the YouTube's position, so this is the CEO's interpretation of their rules and regulations. What they're saying is, we don't care for which doctor said it is good or which doctor said it is bad. We care for what WHO said or NIH said or FDA said or even Merck said, because they quoted Merck as well to say Merck came out and said ivermectin is not good. So because of that, nothing else would matter for them. Then they had that JAMA study. Remember that hydroxysurgeons feel-like study for ivermectin as well. They also quote that JAMA study as well to say, hey, too bad. Go get the trials done so that we can then bring those trials, or you can bring those trials to these organizations. They can say thumbs up. Then we would allow these videos as well. In the meantime, so they're saying, in the meantime, these videos are presenting a drug to people which will be dangerous, and people would go get horse paste and die from that. This is what they're trying to prevent. And because of this, they're doing what you see they're doing. So per YouTube, promoting ivermectin is unsafe because people will get the horse ivermectin and die. There have been no such cases, but anyways, they think this would happen. They won't think that vaccines are doing all of these things and people are dying from these as well. That is fine. Vaccines can continue to go, and so something to think about. So even when ivermectin has done better in every metric, because JAMA study said no and the other organization said no, that is why it is not going to be supported. So that is YouTube's CEO's position. Now, somebody in the same thread, so he has forwarded the thread. In the same thread, somebody said, both the FDA and the WHO have issued strong guidance against the use of ivermectin, the drug mentioned in the videos which are of concern. And then he says, outside the use of clinical trial, even Merck, the manufacturer of the drug, issued a statement against it and recently published a study in JAMA, came to that conclusion. And the Infectious Disease Society of America also recommended against it outside of the clinical trials. People are taking ivermectin forms. So this is a very similar thing which American Medical Association did. Remember, they came out in the early part of last year to say hydroxychloroquine should not be prescribed, and pharmaceutical companies, pharmacies should be allowed to decline these, and pharmacies started declining. By that combination of they had a good hug with Emma about that. And then Emma came back out in November and said, oh, sorry, we were wrong. We should not have done it. But they had caused the damage for the whole year. This is a similar thing here. The damage is done. They might come back after 2 months and say, oh, sorry, we should not have done this. Off-label use for a doctor should be allowed. But they would have caused the damage. So that is, unfortunately, the unhappy news. It made my blood boil. I very rarely become angry, but it made me very angry. And the other, the good news that can make us a little less angry is also from Steve, and that is that FDA has, let me just go and open up that email. This is also from Steve, and he said, FDA approved ivermectin trial is starting. So that trial is going to be metformin versus fluvoxamine versus ivermectin, and ivermectin dose is going to be 0.54 milligram per kilogram for 3 days. So that is a good news. So I thought I would share with you some of this good news as well. that FDA is going to now do some trial. I believe there is another trial going on with the Gates Foundation as well with Ivermectin. We'll see what happens. But I think that the time is getting wasted, and that is a problem. Curious C says, Dr. Bean, time for you to use the F-bomb. So I have been using it throughout the day. I have been using the F-bomb throughout the day on two things. One, people who are trying to say, this is for the vaccine. This is a very rare thing. Why should we be so concerned? Don't be concerned. This is causing vaccine hesitancy. Don't do this. And I was saying, what the F is wrong with you? This is a preventable situation. Let doctors figure it out. These are anchors. I was listening to a CNN anchor, I would name them, CNN anchor this morning, and he was just so surprised at why the hell is breaking loose. And he kept saying, this is a very rare situation. And I was saying, what the F is wrong with you? Rare situation or not, this is something that can be helped. And we can make people aware, just like we could make people aware of vitamin D. We can make people aware of this as well, and that can help. So that is where I was using my F-bombs today. And the second one was this email when I got it and their position. So the thing is this, you cannot fault them for their position. They're saying Mubin or Dr. Corey or Merrick, Tess, they are doctors. So what if they're saying this? The organizations that have the responsibility of declaring what is right, they say no. So we would not let these doctors cause harm. That is where their position enough had been using F-bombs, because they have been letting so much of material out there, and all of a sudden they have become very, very concerned. Nancy, you are correct. Sanjay Gupta's answer was reasonable, which was a rare thing, because when I was listening to him on hydroxy, he was totally unreasonable and was totally wrong. But this morning with that interview, he was reasonable. So I think it was more political stancing before, and now it was less political and more he could think in medical terms. Unfortunately, he didn't do that before. Correct. That is correct, Arun. So what this does is this gives them a lot of time, Arun. And so they can say, well, we are running the trials and the trials will finish and then we'll get the data and then we'll tell you. And meanwhile, there is a lot of time in which either people are getting vaccinated or they are becoming infected, and many of them are going to have damages as well. So that is the issue. So Alexander says, how can I debate or convince my friends, nurses or doctors about Ivermectin against COVID-19? So the best thing to do is to present the data. And again, you know what they would do. They would say, well, WHO had access to this data and they did not agree. So at this time, convincing can only be, for example, present them some videos, present them data, ask them that, hey, it is not going to hurt your patient. It is safe drug. Trying this does not hurt. So why not try it? Maybe if you find some benefit, then continue to use it, otherwise stop it. Why not talk with your patient? So there are so many ways to do it if the doctor is or nurse is willing to. I would tell you that at this time they would be more scared, because of this is why I repeat it every time, that when Dr. Pierre Corey had said that WHO has become irrelevant, and some folks commented that to me to say, hey, Dr. Corey was saying that, I thought it's not a matter of becoming irrelevant. They have caused harm. They have become more relevant because now everybody is going to pick up their name and say WHO said so. And that is what is happening. So they went from 0 to negative. That's what WHO did. Cool. So tell me this, what else is happening? So these are strange day today. Andrea says, question, if someone had severe ITP with COVID, And to balance out the discussion, yes, we did see, I still believe that the Florida doctor, who I think had Pfizer and who died, he was healthy, he never had ITP, and then after vaccine, a few weeks later, he developed ITP. I'm sure that was his adaptive arm that became active at that time. So it is other vaccines too. So we all have to be concerned, but these vaccines have a higher risk. In case of Johnson and Johnson, they had actually written it in their FDA brief that we are concerned about this. So they knew it. The good thing is that they brought it up compared to AstraZeneca, who just keeps saying, well, this must be the similar population number. If someone had severe ITP with COVID and is at risk for these issues post-vaccine, how many days post-vaccine do you recommend checking via lab work? So, of course, clinical first, and that is should start, if there is any issue, 5 days to 17 days. Or CDC, FDA said first 3 weeks. My wife has this, and she has become so bothered by me asking her all the time, do you have headache? Do you have any stomach ache? So she's fine. She had headaches earlier. So clinical 1, and then after the clinical platelet factor 4 assay, which is an ELISA assay which can be done quickly. These are those tiny little things that can be done, and it is for the first 3 weeks or 5 days to 17 days. Denise says, yeah, that already 80 freaking trials weren't enough. Yeah, that was not enough. Correct. Mia says ITP is immune thrombocytopenia. Yes. Mark says, I had to order PET Ivermectin online here in Australia. And Mark, that is what our WHO and YouTube is trying to protect you from. Steve says, I thought, do you have a headache? Means something else between married folks. Oh, so we may have different code words. Ditching the grind says, question, Dr. Bean, what is a vaccine booster? Vaccine booster is really, instead of saying vaccine booster, should be called an immune booster. So what happens is, if I get some antigen in me today, depending upon the dose of that antigen, my body would start responding to it. And then my adaptive arm would start working as well. And now I can do hand waving because we've been talking about that adaptive arm for a year now. So my adaptive arm would start becoming active, and it might take anywhere from 5 days, 10 days, as you can say, even 17 days. Then those cells that have been formed, helper cells and B cells that have become active, they would do their function for a few weeks, months, and then they would say, well, we're not seeing this antigen anymore, so we should go to sleep. Many of them would do apoptosis. Many of them would kill themselves and say, we're not needed. And many of them will become memory cells and would go to sleep and wait for the actual antigen to come. Now, when you give a booster dose, it actually boosts the immune system. It wakes up those sleeping guys and says, I'm here. And these guys say, oh man, this thing actually happened. It is back here. So we should work again. And they would then immediately start proliferating, increasing in numbers. They would refining their binding to that antigen. They would start producing antibodies again. And generally, they would increase in number. So now even more sleeping cells will be formed. They would go into even more parts of the body and go and sleep there. And so that would now mean that the immune system is boosted. Now these cells might work for another couple of months and then go down. But now we would have more sleeping cells. That is a booster. Jeanine says, Dr. Bean, having second vax tomorrow, I had Bell's palsy in 2011. Is there a concern? So if you already had the first dose and that didn't do anything, then you should be okay. But this is a very, very specific question and specific history. Should talk with your doctor, talk with the provider as well. When I went for my vaccination and I said, well, I had this allergy to this drug, She kept saying, why did you not talk with your provider? Why did you not talk with your doctor? I'm not going to give you the vaccine. So it became an issue because they cannot treat everybody over there and see their history. So talk with your doctor as well and say, hey, this is what was the situation. I think, in my opinion, this should not be a problem, but the risk is this, that if the second dose triggers too much of the immune system and the inflammation is too much and the body becomes a little weaker, and that causes, let's say, some viruses to become opportunistic and attack, or that causes so much inflammation instead of lower that the inflammation occurs here as well. So just talk with your doctor. Andrea says, good night. Saber Steve says, hit the like button, smash the bell as well, make Luffy a happy cat. Absolutely. Don't forget to take your Ivermectin. Yes. Which YouTube is actually actively trying to bring it down. Samina Chaudhary says, question, COVID positive pregnancy protocol. Low molecular weight heparin, whether they should stop it 12 hours before C-section. They should stop it, absolutely. And keep their vitamin levels correct, keep their vitamin K levels correct as well, so that the bleeding does not happen. And of course, with the C-sections, part of protocol is to have the blood arrangement as well. But yeah, they should stop. And I was able to talk with Samina about it because I know she is a physician as well. So this was a physician to physician talk. Somebody was upset with me that you sometimes provide advice and sometimes you don't. So it's just that when I'm talking with a doctor, I know that I'm talking with a doctor. Ivermectin. So Ivermectin, yes, Ivermectin. Marie says, given the fact that the J&J vaccine is not as effective in some ways as the other two vaccines, would it make sense to get J&J booster using the Pfizer or Moderna vaccine? So that is what they were doing. They were doing a trial of a J&J booster as well, which needs to be stopped at this time too. But you're correct from a mechanism point of view. Yes, a booster may be interesting. Machiavelli says complement system is implicated in lung inflammation. Complement system will be implicated in all inflammations because it is part of the inflammation mechanism. Svetlana says, is there anything suggested to take after first Pfizer vaccine to minimize any possible side effects? Pfizer has been given to a lot of people. There have not been lots of side effects, but CDC, etc., they had said you could take painkillers and other drugs that you usually take after the vaccine. Fly vaccine. Yeah. Margaret says, what do I tell my friend in Germany? She thinks all is okay. What do I tell my friend? So that is it. Just be careful. I think that sent them this link to say, just be mindful that if you develop persistent pain, headache, GIT pain, leg pain, shortness of breath, bleeding, some bruising, discoloration of the skin, joint pains, there could be bleeding in the joints as well. So at least be aware. And it is not necessary that this happens to them. Maybe it happens to somebody else and they can help. Be aware. And here is a protocol for management as well, in case your doctor needs to understand more. And I can tell you that I've been calling some doctors today, and majority did not know how to respond. Yes, doctors which mattered, for example, the one in the ICUs or in the hospitals, they knew it. So when I talked with them, they said, yeah, I'll do this, and I'll take care of the patient. Then thing is, we have to be mindful early on so the patient doesn't go so much down that it becomes a risk for them to survive. So Margaret, I would suggest to share these and just, without making them feel like they are being told something, just that, hey, just be aware, this may happen. Colombian Bean says, many developing countries don't have access to vaccine. WHO is willing to let them die in order to pressure people in developed countries to get vaccine. WHO did a lots of damage. Ivermectin should not have been. They should have kept quiet. I guess. Colin Hamill says, news. Court orders New York hospital to administer ivermectin to COVID patient, and she became, yeah. So I know about that. Maybe now we have to have the court order YouTube to allow ivermectin videos. George Baltran says, any insight in the Lancet article about the use of budesonide in early treatment? It reaffirms Dr. Richard Bartlett's protocol. Seems promising. George, I did not get a chance to read that yet. I will have to look it up, but I'm sure that it is positive. Rajat says, Dr. Bean, are we doomed to run this variant versus vaccine race forever? No. So number one, I still believe we'll use ivermectin. Many countries are able to use ivermectin. So that's number one. Hydroxy zinc is also useful. The supplements are also being used. So number one, I think generally people would continue to become more and more strong and take care of it. People are not, just like we keep saying virus has an escape, humans have an escape as well. You cannot keep pressing and damaging them for a long time. They resist and they get out of that problem. So I think that if WHO says it, people would continue to figure out the ways to manage themselves. That is one. Secondly, I think that the variants are taken care of by the vaccines at this time as well. So if you combine these 2-3 things, that number one, supplements and those with mask and social distancing, add then ivermectin, add vaccine. If various groups are doing one or the other of these, we should be fine. Curious says, yeah, so maybe at some point they need to go to court. Chuck Becker says, I love what he's saying right now. It's huge. So Chuck, I want to show you this. This is the vertical mouse I have. So I love it because my hand, it has developed a lot of pain. I think over the year, continuously drawing and doing things like this, the hand has tendinitis, which is just not healing very easily. So during the week, it becomes swollen, and during the weekend, when I take rest, it becomes less. So this mouse has actually really helped. Why? Because my hand doesn't have to be like this, and it can continue to be like this, and I can use this and work with it and move the hand like this. So this position is much more restful compared to the other. And I want to thank Margaret for this. And I want to thank folks who suggested it for this, and to Margaret for sponsoring this. So thanks to everyone. Potorrero says, question, what is the interaction of ivermectin with alcoholic beverages? Asking for a friend. Tell the friend that it does not have any such interaction. Ivermectin is metabolized in the liver. So somebody who has kept their liver too busy with alcohol or have damaged it, then that is a separate situation. But if somebody has just a reasonable use, then ivermectin is not a problem. Ahmad Moines says, what do you think? Sorry about not pronouncing the name correctly. Moines says, what do you think about Tocilizumab in COVID ICU patients who have a cytokine storm? We administer it as a response to high IL-6 here in Egypt. It works. So Tocilizumab is very useful. Of course, Dexa is very useful. I feel that leronlimab is useful as well. That patient in Philippines who was on ventilator, he's off the ventilator, so that is very useful. So I actually like Tocilizumab. James Crook says, thank you for all your great info on C19 and other medical areas. You are very welcome. Thank you very much for being with me and studying these things together. And thank you very much for the super chat. Yes, so Curious C says, have you tried a rolly ball mouse where the ball is used by only one thumb? Yes. So I actually bought that one first. And the problem was that my hands become so dry that my thumb slips over the ball. So it became very difficult that I had to either continuously moisturize my hands or just press it hard. So when I would press it, it would just do weird things. And so this actually worked better for me. I actually bought that, then returned it and got this one. And this one I got from I believe somebody's suggestion here from the Cool Beans. Loretta says, thank you, Dr. M. I have a meeting, must go. Bye. Thank you, Loretta. Have a good meeting. Renee says, question, what country uses the most ivermectin and what do the statistics there look like? I think that there was Zimbabwe did very good. Peru had done very well till the point that they were using it. Of course, Pakistan, India have used it. In India, Uttar Pradesh has done it with very good results. Pakistan uses it very commonly as well with very good results. Think about it. Pakistan, India, 1.38 billion people. And Pakistan, 220 million people, about 2/3 of the US population. But if you look at the number of cases and deaths, that is just very minimal. And the reason was Pakistan started using hydroxy and zinc, and then they started using budesonides, and they started using steroids very early on. They started using ivermectin now. They started using remdesivir. They are doing vaccinations too. But over there, because many of these things are over the counter, people just learned, and doctors, the outpatient doctors, general practitioners learned to manage their patients. They were not waiting for WHO. India did this. India actually with hydroxychloroquine, WHO came out and said, don't do it. And India said, no, we will do it. I actually liked that. The number one, the bravery, and number two, their own confidence to say, well, we're going to save our people. And this is something that is working. Gaba says, I only have access to hydroxychloroquine. What would be the prophylaxis? One, in my early videos, I've talked about it. Second, please be careful. It can cause heart rate to go up and down and blood pressure to go up and down, and that can be a problem. I have had that with one of the patients, one of the family I managed. So with this, hydroxychloroquine, usually, why don't you watch, the very first video I had done was, can hydroxychloroquine help COVID? I have discussed the dosage in there as well. Must be taken with zinc because zinc would help further potentiate the effect of hydroxy. Marina Kostyuk says, because ivermectin and hydroxy are beneficial, can we suggest parasitic etiology of COVID? No. These are molecules that have effect on the mechanism of action of SARS-CoV-2. These molecules do not have a registration or an ownership of working only against the parasites. And that would be that if they work against any virus, that is a parasite as well. It's just that they have a decent mechanism that is against these. For example, in case of hydroxy changes the pH of the cell, which causes the virus to have difficulty in replicating. The same mechanism is used in parasite, what hydroxy or the stomach, the mosquito and the malarial protozoa, what it does is it kind of makes their stomach less acidic, and they cannot do digestion anymore, and that is how they die of overeating. So that is a mechanism which is useful in both of these things. It does not mean that the SARS-CoV-2 is malarial parasite. If you look at ivermectin, for example, blocks the importin alpha and beta of the virus to go into the nucleus. Now that is a mechanism of this molecule. on the parasite, it helps by blocking their muscles from functioning. Now, virus doesn't have a muscle, and we can't say that because it blocks a muscle, then the virus should have a muscle to block as well. Virus has other mechanisms that luckily this drug can block. Samina says Bangladesh using Ivermectin from the beginning, but recently the national protocol omitted it after WHO, but still many of the doctors prescribe, of course. And Philippines, look at Philippines. They banned it. They said a Cool Bean had sent a note today that, let me see if I can find it. So the note was somewhere over here. It came from Cool Bean, who said that in Philippines, so it was from Philippines, and he said that in Philippines they have just banned it and said to doctors that if we see you using Ivermectin, we'll cancel your license. So there can be even adverse things than WHO's messaging. There can be people canceling licenses. Margaret says, what organizations oversee the WHO? Does the president know about this? So the thing is this, WHO is funded by all the countries. That is how they work. I think that WHO is influenced a lot at this time by China. And then, of course, US was a big donor to WHO, so we did have some influence. Trump stopped that. Then I think we have started it again, but WHO at this time is not very much aligned to the US's policies. US itself is also not doing very well with these things, but this is how WHO is. And the thing is this, if let's say if our president could do something, he could have asked CDC and FDA to say, approve it, let people use it, give them, I have been saying it from a very long time, allow the people to sign a disclaimer to say, I would not sue my doctor. I would not sue the insurance company. I would take it. Fine, I can write it down. So those who are convinced for this, they can do it. Those who are not, they can refuse it. But allow the off-label usage. So that can be done within the country without the WHO. India did it. Our country just is not doing the right thing. Yes, there is a right to try law, yes. So let's do a couple of more questions and then we break for today. We'll continue tomorrow. Have there been any discoveries of benefits from ivermectin for other medical conditions and diseases? Yes, a lot. It has been seen to be a very good anti-inflammatory. It has been used for other diseases, other viruses as well. So just do Google. France says, by the power vested to me by my mom. Lol. I hereby name them OHW. Good one, France. Good use of your power. Cool. So one more question and then we break. Zia says, Dr. Bean, my sister had Moderna vax 3 weeks ago, was fine, and this week has fever of 100. Chills, body aches, headache, second jab due this Friday. Should she wait? So don't know if it is because of vaccine or not, but if I try to connect them, the reason could be the same as we looking at others, and that is adaptive arm in some people can take some time to make sufficient amount of antibodies, which will then enter our body and respond. In my opinion, if she has these side effects, I would wait a little bit and then take the second dose just to make sure that my immune system has settled down before you kind of irritate even more. That would be my opinion. This is not an advice. You decide whatever the best is with the doctor. but this is what I would do for my patient. Cool. So how about so there's one more question, Galaxy. How about providing each home with an oximeter, H1 antihistamine leukotriene inhibitors, lungs involved? Yes, absolutely. And how about adding Ivermectin pack for them? Believe me, you're so correct, Galaxy, that this would not have been even an issue. We would not even be talking. Somebody was saying in news yesterday that $6 trillion lost. Well, much less than 6 trillion, we could buy these items for people. And we could even do this. I actually thought of doing that. We could do this at somebody who is ill. We bring these things to them. When they have recovered, we sanitize them and then put them in a storage somewhere where somebody else can go and get it. And so you could even recycle these things other than the consumable parts of it, the drugs. India says, I'm so grateful for you, Dr. Bean. You make such a difference. Thank you very much, India. I'm very glad to be of service, and thank you very much for your super chat. I'm actually really glad and grateful for this service. I just don't make it up. I'm very grateful to be able to offer these, to study together. So how about we break for now, and then we continue tomorrow. Thank you very much for your time. Please like, subscribe, and share. And there are 3 links in the description. One is to buy me coffee. The benefit of buy me coffee is that it does not use PayPal. So if you don't like PayPal, you can use buy me coffee. Then another link is there to become a patron. And then there is another link to support this work in general. Thank you very much. Stay safe and happy and healthy. I will see you tomorrow.